Me, Dr. Bhavani Shankar Pal, Professor and Head, Department of Roga Nidana, IIMT Ayurvedic Medical College and Hospital, Meerut. Today, I am going to discuss regarding the topic Aetiopathological study on Jaundice. This Jaundice in Ayurveda we say Kamla, and local language we use Pilia Bimar. It is a disease of hepatobiliary system. Hepato means liver, and liver connected with the other passages that constitute the hepatobiliary system. The main feature of jaundice is the yellow pigmentation of the skin and or sclera by bilirubin. When bilirubin portion increases in the blood, in the body, then the body sclera part of the eye, nail and skin that discolor into yellowish. To this in Ayurveda says Haridra netraha sabhruncham Haridratvam nakhananaha. Haridra netra means the first the white part of the eye that turns into yellow. Then the skin also turn into yellow. Then Haridratvam nakha and anana. Nakha means nail, that also becomes yellowish, and face also yellowish. So yellowish discoloration, this is the main feature, main symptom, sign of this disease, jaundice. You see, these are the pictures. The face, the nail, the eye, it is well focused here, then nail. For the examination of jaundice, we often use the sunlight, means outside the room in the daytime. It is not that direct sunlight, but the outside the room we examine the patient. During this examination, we pull up the upper eyelid, then advise the patient to see to the bottom, to its feet. Then during this, what happens? The sclera of the eye, it is clearly visible. So we can see, we can examine the yellowish discoloration very clearly. So it is not advisable to see the patient inside the room and during the night time also. It is not advisable, because if there is little jaundice, then there is chance of not recognition. Then the etiopathogenesis, what are the causes of the jaundice or the kamla, and how the diseases processed are formed. It is told that Pandurogi tu jyotirtham pittalani nisevate. Pandurogi, Pandu means it is also a disease. We say the anemia in modern term, where there is less blood means less hemoglobin. So if such a patient consumes again more pitta aggravating diet or activities, then the pitta of that person that increases, and this increased pitta that burn means vitiate the rakta and mansa of that rogi, of that person, and form the disease. So, excess production or less excretion of bilirubin converts into hyperbilirubinemia is the cause of yellowish discoloration of skin and sclera. This is the modern concept and this is the Ayurvedic concept. Ayurveda says increase of pitta is the cause of disease, and modern says it is bilirubin. Pitta is also yellowish in color and bilirubin is also yellow in color. Then apart from this yellowish discoloration, what are the other features, associated features in this disease? Rakta, Pitta, Sakronmutra, Bheka, Varna, Hatendriya. Rakta means red color, like Rakta means reddish. Then Pitta means yellow. So red or yellow color of urine and stool and urine. Then Bheka Varna means the Bheka is the frog. So during the rainy season, in the marshy land we see some frogs. So those frogs, the ventral side of the frog is yellow in color. So color of the patient resembles with the color of the ventral side of the frog of rainy days. That is Bhekavarna. Hatendriya means the sensory capability of that person that declines. Then there is Daha, burning sensation, Vipaka, indigestion, Daurbalya, feeling of weakness, Sadhana, suppression of all bodily activities, then extreme weakness. These are the associated features of jaundice. Then what are the components, body parts that take part in the disease process? Dosa is Pitta. So it is solely a disease of Pitta dosa aggravation. Dusya is Rakta and Mansa. Adhisthana means site is Kostha, Mahasrota, Yakrut, Sakha, Raktadi, Dhatu and Tvak. Then Srotas, Rasavaha, Raktavaha, Annavaha, Purishavaha. These are the Srotas. They are involved in this disease process. Then according to modern concept, this disease directly related to liver. What I have already told you. This liver is the largest organ in our body. It weighs about 1400 grams, 1 kg 400 gram its weight in an average. Then it controls our body metabolism. Also it does some major functions for the body. 5 type of functions conducted by the liver. One is the manufacture of bile. This manufacture of bile is directly related to this disease, jaundice. Then apart from the manufacture of bile, then it manufactures plasma proteins, albumin, fibrinogen and prothrombin. Then metabolize the protein carbohydrate and lipids, storage of vitamins A, D, B12 and iron, then detoxification of alcohol and drugs and chemicals. So, these are the major functions conducted by liver. Then bilirubin metabolism. This bilirubin is directly related to jaundice disease. Jaundice. So, how the bilirubin is formed and it is metabolized? First, the source is the breakdown of RBC. Means when the lifespan of RBCs it is already over, means in an average about 120 days is the lifespan of the RBC. After that, just like our batteries, they are exhausted after some days. Similarly, the RBC also is the function is exhausted and the cell breaks down within the reticuloendothelial system. There are some macrophages. They within these macrophagic cells, within these cells, the RBCs break down. When RBCs break down, hemoglobin is liberated. Hemoglobin is heme plus globin, we say hemoglobin. Heme is the iron part, globin is a protein part. This heme part is converted into biliverdin. Then biliverdin is converted into bilirubin. Now, this bilirubin which is newly formed, it is unconjugated one. What do you mean by unconjugation? Unconjugated means this bilirubin is lipid soluble or fat soluble. Due to of its fat solubility, it can cross blood-brain barrier and it can reach at the brain cell. Such type of bilirubin is toxic to the brain cell. It can produce injury to the brain cell. This why the liver convert the unconjugated bilirubin into conjugated bilirubin. So, conjugated bilirubin is water soluble, means from lipid soluble to water soluble. Transfer or the transformation of such bilirubin is done by liver. So, for this purpose, the newly formed bilirubin, which is unconjugated one, it is trapped by some proteins, means albumins, and it reaches into the liver cell, that is known as hepatocytes. So, within this hepatocyte, its solubility is transformed and now it is told as bilirubin mono and diglucuronide bilirubin. So, after that the bilirubin is excreted from liver through bile. First it goes to the gallbladder, then from gallbladder, when the bile is needed for the intestine for the purpose of digestion, then bile is excreted to the duodenum through common bile duct, and bilirubin is present now at duodenum. So, from duodenum again it is digested or it is transferred. A part of this bilirubin is passed through the feces stool, and this bilirubin is known as stercobilinogen. So, stercobilinogen is the bilirubin that is present in the stool and gives yellow color to the stool. Then from intestine again the bilirubin is absorbed through the portal circulation, reach into the liver, from liver to heart, and from heart to again kidney, and it is excreted through the urine, and this bilirubin is known as the urobilinogen, and this urobilinogen gives yellow color to the urine. So, this is the funda that why our stool and urine looks yellow. So, jaundice is a disease in which bilirubin is increased. Again, we have already discussed that bilirubin means it has two components, unconjugated and conjugated. Means when we add both, then we say the total bilirubin. So, on the basis of its conjugation, it is classified into two types, whether it is predominantly unconjugated or conjugated. Then, if it is predominantly unconjugated, then what are the causes? Increased bilirubin production due to intra and extravascular hemolysis, means excess breakdown of RBCs, whether there is a cause within the RBC or the above from the RBC. Then ineffective erythropoiesis, then decreased hepatic uptake. Decreased hepatic uptake means the liver itself in a ruined condition, so it is unable to receive and convert the unconjugated bilirubin into conjugated bilirubin. So, if liver is here in a ruined condition, then unconjugated bilirubin becomes high in the blood. Then what are the conditions? What are the causes? Drugs, prolonged starvation, and sepsis. Sepsis means infection. Then decreased bilirubin conjugation. Hereditary, some disorders like Gilbert's syndrome, CN syndrome. Some acquired defects like drugs, hepatitis, cirrhosis, and neonatal jaundice. So, these are the causes of unconjugated hyperbilirubinemia. Then predominantly conjugated means here liver is okay, maybe production is okay, means breakdown of RBC is okay, and but here liver condition may or may not always okay, may okay or may not okay, but in the blood the conjugated portion is more. Intrahepatic cholestasis means within the liver there is stasis, stagnation of bile. Hereditary disorders like DJ syndrome, Rotor's syndrome, fibrocystic disease of pancreas, intrahepatic atresia, cholestatic jaundice of pregnancy. Then some acquired disorders like viral hepatitis, drugs, alcohol, sepsis, cirrhosis. Then some extrahepatic cholestasis, means the cause is beyond the liver. Here mechanical obstruction, gallstone, inflammatory stricture, carcinoma in the head of the pancreas, then tumor of bile duct. So these are the conditions where there is bilirubin is predominantly conjugated. Classification. This is the face yellowish discoloration is picturized. Then first the hepatic jaundice. Hepatic jaundice means where liver is ruined or liver is directly involved. Some immunologic damage means some antigen antibody related cause is directly related to the inflammation of the liver. Hepatitis means inflammation of the liver. Then some infections like viruses, some bacteria, fungi, then protozoa, they cause the inflammation of the liver. Then some toxic damage. Toxic damage means toxic substances like alcohol, drug, poison and chemicals. They also produce hepatitis. So, if there is hepatic jaundice, means directly liver is involved in this condition, then all form of injury to liver result in necrosis of liver cells. Viral hepatitis accounts major portion of hepatic jaundice. Anorexia, nausea, vomiting, fatigue, malaise, arthralgia, headache, low grade fever, dark yellow urine, clay stool, pruritus. Pruritus means itching body. Then weight loss, liver tenderness, tenderness in the liver area. Then enlargement of the liver. These are the features found in hepatic jaundice. Then major portion of hepatic jaundice is viral hepatitis. Means hepatitis caused by the hepatotropic viruses. There are 5 types of hepatotropic viruses named as hepatitis A, B, C, D and E. This is the molecular structure of hepatitis A virus. This is the C virus. This is the B virus. This hepatitis A virus, it is found in a larger form in the society. It infects the person in the fecal-oral route. Means some hepatitis patient, if passes stool outside the toilet, outside the house, then that contaminate the soil, then water. Then this water, if means contaminated water consumed by a healthy person, then the person victimed by hepatitis A. Then hepatitis B, it causes a lethal type of jaundice. Often it produces carcinoma of liver. Then C, D and E, they also in lesser amount, they are also found in the society. This is the picture of classical liver lobule. The unit drain the portal triad. Then from the means these are the portal triad. This is the lobule. So there is a vein, artery and duct. Then this is the central vein. Then this is the normal structure of the lobule of liver. These are the hepatocytes, they are arranged in cords. Means this is the direction of flow. Then during the hepatitis condition, the arrangement of hepatocytes that is distorted and they looks like this. Now come to hemolytic jaundice. Hemolytic jaundice means where hemolysis or breakdown of RBCs are more. Means if there is more breakdown of RBC, means there is more production of unconjugated bilirubin. Liver has a certain capacity to conjugate it, but if the workload is more, then the liver is incapable to consume to transform and conjugate the bilirubin, and such type of unconjugated bilirubin, it cross the blood-brain barrier and produce the the damage to the brain cell, and it is lethal for the person. So excess red cell destruction leads to overproduction of bilirubin, result in jaundice. Features are anemia,